Hello everyone, thanks for visiting my channel. In today's video and a live feed on YouTube, I wanted to go over the situation happening in China at this point with regards to the virus. Apparently is spreading like a wildfire. If you check the social media networks like Twitter or other social media feeds, you will see that virus apparently is spreading like a wildfire. If you check the social media networks like Twitter or other social media feeds, you will see that the severity of the situation is quite drastic. Um, I'm going to go through some Twitter feeds here, and you can see the situation in Wuhan and other cities seems that they're on lockdown. People are uh, ill, apparently from the photos and videos. People are just standing in line fainting, and many people are have died. They're in body bags. The health officials are um, having difficulty handling the situation. Doctors, nurses, and medical professionals. There's not enough supplies, and the demand for people to help these people is quite great. So we can see some information here on Twitter. Uh, there seems like there's some protests. People are protesting in the city. There's also an image of Wuhan being like no cars are exiting the highway to the city. Um, so it seems like it's definitely a dire situation at the moment, and even the world, like United Nations and World Health Organization, seems like they're having emergency meetings at the moment to prepare for some, I guess, decoding of the coronavirus. This they're calling it the Wuhan virus, and to develop a vaccine for it. Although would have very limited effect on people uh, in a situation that the vaccine basically replicates and transforms, which could happen within a week, even less. Some vaccine viruses can change their RNA within a few days. So the situation is somewhat very difficult, and there's a lot of video situations of people like they're having some mental breakdowns, and it's like a very difficult situation to handle, and to realize that people are getting very ill and sick and dying in front of you. So our hearts go out to the people of Wuhan and of China, and hopefully the situation can be somewhat stabilized, at least clarified on a treatment. But from my readings, I've seen journals dating back to 2003, 2004 of the coronavirus, the SARS-related coronavirus, the one that causes severe acute respiratory syndrome. And it seems like there has been a lot of research in this domain. At least 4 coronaviruses have been identified in humans, and apparently this one is a virus that is transported from animal to human. Well, some reports are saying that there could have been some biological weapon that or testing that could have been involved here on animals, and then it got spread to humans. But this is not very clear yet as to situations like this, as we know, are not going to be revealed to the public. This could be a lot of speculation, and we don't know for 100% sure. We know from the New York Times and other major newspapers have declared that in France now 3 cases have been confirmed of the coronavirus. Um, it's very interesting that when these situations arise, we don't see any call. Like we already know, like naturopathic medicine is already somewhat suppressed around the world. It is growing though, like in the United States, Canada, and Europe. There's a desire for people to seek naturopathic remedies and treatments, especially in the treating many chronic diseases through food and diet. When we see situations like this where governmental organizations don't have a remedy for this virus, there isn't any call for the there isn't any call to go back to uh, the old remedies and ancient remedies, which are eliminating toxins from your body through fasting, through infrared sauna, through heat treatment. There isn't any call for this. There isn't any call for, hey, maybe the food that you're eating is full of toxins. Maybe the air you're breathing is full of lead. Maybe the water you're drinking is full of fluoride, and that's suppressing your immune system. So we see that when there is a situation, yes, if a vaccine is available to help stop this from spreading, okay, that's great. We can go through that. But why isn't there a call for people to go back to natural means of eating and of living and of drinking water, which play a very, very, very important role in your overall health on the long term and also on the short term, but mostly for chronic diseases. So we don't see that at all from any government officials. Although you can, there isn't a city where you can't find, say, a homeopathic doctor, a naturopathic doctor. So why do we allow these doctors or clinics, these naturopathic clinics or homeopathic doctors to practice if we don't want to give them any recognition or any um, say in situations like this? Why do we always have to resort and wait for the governments of the world to prepare a somewhat mysterious vaccine that does it work? Does it not work? Is it really working? Is there proof of it to work? How can we guarantee it's going to work for a few days or a few weeks or a few months? Knowing that this coronavirus has been, the SARS related one, has been documented from 2003. So we're not sure exactly. Let's see if we can read through more on Twitter. Um, so 50 more people died from a coronavirus outbreak in Wuhan, China, pushing the death toll to 41. So that's the officially recognized number. Now, some people are saying it's in the thousands, but again, if that's just speculation, we don't know for sure. But you can see the videos. The videos can speak a lot. Like nowadays with social media, with although it's restricted in China, it's coming out. The videos are coming out. So and they're being posted here on Twitter. So you can see the thousands of people on the streets, waiting in the hospitals. Thousands of people in the hospitals. Many people standing on their feet waiting. I heard for hours. I was reading hours, and so it is. Which numbers are the right ones? In the end, we know that this is a very dangerous virus that's spreading, and it seems like it's going to be a global issue unless it's rectified and stopped. So let's see what else is happening here. So there are 5 confirmed Wuhan coronaviruses cases in Hong Kong now. So the chief executive in Hong Kong says she's going to have a meeting with officials today. She'll put public health safety as first priority, but she refused to answer if government will ban entry of Wuhan tourists. Okay. Someone here has posted, China is rushing to build a new hospital in just 10 days to treat patients in Wuhan. It will have a capacity of 1,000 beds, 25,000 square meters, sorry, not feet. I hope they hurry up with that vaccine for the Wu flu soon, or Captain Trips is gonna. Okay, so some people, they'll just have sarcastic posts, and I don't think, and when it's a serious situation, I know it's far away from us, but you never know when it hits home. when it hits home, it's not going to be that funny anymore, right? Like when SARS hit Toronto, and in 2000, we had approximately, I believe it was 20 or 25 people that died, if I'm not mistaken with the number, but it was in that range, and it was very stressful. People were really hesitant going to the train, to the subway. People were just staying home, not going to work because of the fear that they could get infected. And but again, there isn't a lot. There is definitely a lack of um, going going back to natural remedies to treat illnesses, especially when you're affected by a terrible virus that is occupying your lower respiratory tract and is just taking advantage of a weakened immune system. We have to face the fact that we're all um, have very weak immune systems. Most people, if not 90% of the population, has candida infections, viral fungal infections, internal fungal infections growing, whether it's children, adults, or elderly. And most of the people that die, for example, from cancer are dying not because of the cancer itself, but because of the weakened immune system that's causing the cancer to overgrow, and also the candida, which kills off most cancer patients. So if you read, you can go back to the journals in Switzerland, and for 20 years or so, there's a lot of journals there about candidiasis and how that kills people, and it kills children, it kills any uses to expand and inflame the body, um, furthering other infections to overgrow and then kill off the person. So, um, okay, so there's 3 cases of the coronavirus in Malaysia, wife and her 2 grandchildren. This is from Channel News Asia. Wuhan virus, Malaysia confirms first 3 cases, all patients related to China. Not a global health emergency yet. World Health Organization. Of course, we don't. People are not gonna, like, the WHO is not gonna come out and say it's a global health emergency until it becomes one, or it's actually um, at that point, or drastically beyond that point. So as long as they have some sort of control, they're not going to claim that it's in a global emergency. But we don't know exactly the situation yet. But from the videos that we're seeing and that I'm seeing here, it seems like, unfortunately, feeling well. It seems like they have the fever, they have the symptoms, the normal pneumonia symptoms, and that's worrying them to go to the hospital. Okay. Okay, so this is inside the Wuhan quarantine. So state-run China Global Television Network reported that a doctor at Hubei Jinhu Hospital, who had been at the front line in battling the coronavirus outbreak, has died from the virus at age 62. So it's confirmed that a doctor has died. There's some other images here. Cities near Wuhan are closing streets and borders. People are oriented not to leave their homes, which would make sense, right? Like in a situation like this, you want to, if you're feeling well, I would say, yeah, like stay at home. But if you're not feeling well, maybe even staying home is better, because the hospitals are jam packed. I don't think they're gonna, like, nurses and doctors are not gonna be able to get to your attend to you in a timely manner. At least at home, you have, some food, some water, some place to rest, and try to fight it off. Try to let your immune system work on fighting it off. Okay. Someone here has posted Someone here has posted that this John Hopkins University Center for Systems Science and Engineering launched tracking map website of the Wuhan coronavirus as it appears to be rapidly spreading around the globe. And you can see, yeah, so you can see some mapping. I don't know um, if that's just exaggerating somewhat that it's rapidly spreading. We know that it's well, if it's coming to European countries, then sooner or later more people are going to get infected. It's terrible that this is happening at the beginning of the Chinese New Year. So it's terrible that this situation has happened now. That it's the Chinese New Year, and I'm not sure what this person is. Okay, so it seems like some business owners are devastated because of the situation, and they're just destroying their products because their whole business, I guess, has been suffered significant losses. Oh, okay. China stocks plunge, Asia markets drop sharply as Wuhan virus fears deepen. European stocks close higher as World Health Organization says no global emergency yet for the China virus. Hmm, okay, can we find more information here? So France reports first cases of infection in Europe. So a virologist in Wuhan reports the government there has become paralyzed and has lost the ability to fight the coronavirus outbreak. This person believes Beijing is also incapable and therefore appealing to the international community for immediate help. These are again Twitter feeds we can't guarantee, or I can't guarantee that how um, true they are, or the some of them really don't give you sources. So okay. This is from the Wall Street Journal. The families of three people who died in Wuhan this week described discrepancies between information they received from doctors and what appeared on the death certificates. Oh, wow. That's from the Wall Street Journal. So let's go into that a little bit deeper and see what's that all about. Three pneumonia deaths raise fear not all coronavirus victims are being tallied. Oh. So it says here a 53-year-old fitness trainer died on Wednesday after checking into a hospital in Wuhan. A little more than a week earlier, said his niece, his family had expected the death certificate to reflect the deadly coronavirus. Because as his conditions deteriorated, his doctors told his family he was suffering from an untreatable virus in his lungs. Instead, it recorded severe pneumonia as a cause of death, she said. The relatives of two other people who died in separate hospitals in Wuhan this week also described similar situations, saying the causes of death had been given all viral pneumonia. I'm going to post this link here so you guys can take a look at it if you want. Yeah, that's there. Okay, that's interesting. Yeah, so that happens commonly as well, even with the situations, people that or people that have vaccine reactions or that may have death-related injuries due to vaccinations. Many of the declared reasons or outcomes of the situation of the death, or say um, the disease or injury that could happen, is somewhat at times stated something else. So it could be stating, for example, uh, just injury to the brain, or so you see that a lot. Not it's not just in this particular example that they just mentioned here, but that can happen in other situations. Specifically, if there's same medical malpractice or other issues. Okay. Okay. So there's a mental collapse of a nurse. I can't bear this anymore. Terribly heartbreaking. If you are not prepared for this desperate scene, don't click. Okay, yeah, I can see that here, but there's the people there in the room are not really showing much reaction, but this person is in a hysteria. But the rest of the people in the room are just quite inanimate. Yeah, so now again, we don't know how much of this information is going to be uh, exaggerated or amplified in a way, because we can't really source some of the posts on Twitter for sure. Um, and a lot of it would be like, say, this one is if there's any sort of feelings to the Chinese government, then for sure they're going to amplify more and more the number people that are against the government there. But we don't know for sure 100%. Like this one stating there's 100,000 people infected. Um, it's not clear yet. Like, okay, yeah, yeah. Oh, this is interesting. This is a photo. Where is it sourced from? It's not clear. I have to. It's the text is very small. It's not stating where it's like. It seems like it's from a news news site, news website. It says virus hit Wuhan has two laboratories linked to Chinese biowarfare program. So that's interesting. We don't know at all uh, where this is coming from, though. This it's not stated. I have to see where that. I can't. I have to search further to see where um, that headline is coming from. So Singapore states. So Health Minister Datuk Seri Dr. Zulkifli Ahmad told a news conference here today that 3 confirmed cases of the novel coronavirus have been detected in the country. So state 2019-N capital CO capital V in Malaysia. So we already know that. Here's another. See if I can get the link here. There's crowds of people. Yeah, so this is another video. There's, I would say, from the estimate. It's not playing now. Yeah, there's hundreds of people packed in a hallway, and various ages, mainly I would say adults like mid 40s and older, but there's hundreds packed in this hallway, I guess waiting treatment or not sure what they're doing, but it's not very clear where they are. It seems like it's a hospital. Mhm. So this is one Twitter user. Her name is Victoria. I want to complain that although today in Wuhan this phenomena is worse, but there are so many rumors spread in Twitters, not truth. Okay. Someone has replied. What was the reply? There's no reply. Okay. Canadian lab to begin work on coronavirus vaccine. The federal government has given the green light to a Saskatchewan lab to start work on developing a vaccine for the coronavirus. Again, there isn't any source of where this is coming from. This statement, and like it's a picture. Yeah, in times like this, especially going to Twitter, you're gonna see a lot of things not really sourced properly, and we don't know. Things could be exaggerated, things could be fake, right? Or how true something really is. We have to um, wait. We have to really source these statements. But yeah. Yeah, so I guess that's the situation right now. This virus is spreading from out of China, in Malaysia, in France, and in other countries. And it seems like the situation is somewhat, from these images and videos, it's a dire situation in those cities. So we just hope that the situation stabilizes and this gets under control, that no one really dies anymore. People um, can find a solution, or health professionals can find a solution to the issue at this point with this coronavirus. Although this type of virus has been studied at least since 2003, 2004 from the journals I'm reading, and this type, though, it seems like it's quite severe, and it takes way into the patient very quickly. So we'll just have to wait and see. Again, most of the information on Twitter, a lot of it is sourced from news agencies and others. We don't know the validity of it. Yeah, so we'll wait and see. Yeah. Okay, so again, this is dire situation there, apparent from these videos and pictures, and yeah, we'll just wait and see in the next 24 hours what's going to happen, and whether this is going to be uh, put under control, or how much how further this is going to progress through the region. And anyways, thanks for everyone that came. 12 monkeys? What do you mean by 12 monkeys? Eric Dwyer. Where am I located? I'm in Ontario, Canada. Where are you located? Are you from the States? How's my audio? Is it lagging on you guys, my video? Or is it pretty good? Okay, guys, so I'm gonna end the stream now. And if you like this video, please give it a thumbs up. Appreciate if you will subscribe to this channel. I try to post some videos related to the news, some related to nutrition, health, and yeah, I'd appreciate your support. And whenever there's these news, that breaking news, I'll try to come on live so I can, interact with you guys and go through the social media. We'll go through Twitter, some news outlets as well. And yeah, thanks for everything, and thanks for visiting my channel. Take care.